Well, hello guys, this is Dr. McDonald. I'm teaching your A&P 1 class, Biology 2113. This is Chapter 1 PowerPoint, which is on Blackboard, and this is the video lecture that goes with it. So I'm going to go ahead and start on this, and we'll see where we can go from there. So A&P 1 Chapter 1, just some, sorry guys. Had my thing out. Let's see. May have to do my little picture. No, I'm good. Anyway, anatomy, the definition of that, which you do need to know, is the study of the structures. It's how things are shaped, how they're built. And we'll talk more about the function here in just a little bit. There's some major subdivisions of anatomy, gross anatomy, which is the structures that you can see with your eyes, the larger structures. The regional anatomy, which is the area of the outside of the surface, really. Regional kind of surface, but more like just where on the body is it. We'll talk more about that in this PowerPoint. Surface anatomy is just, it's really kind of the same as regional, but it really only refers to that area of the skin that's over a particular region. Systemic anatomy, which is what we are going to basically do through A&P 1 and 2, is where we take a certain organ system and we go through it. We're going to do a lot of preliminaries in A&P 1, and then we're going to get to the skin. We're going to do the skin. We're going to do the skeletal system. We're going to do the joints, the articulations. We're going to do the muscles and the nervous system. And then starting in A&P 2, you pick up the rest of the major organ systems. We're going to be talking about all this, so don't worry about it right yet. So that's gross or macroscopic. Microscopic, we're going to be doing that before we start the system anatomy, and that's going to be the cytology, which is the study of cells. Histology is the study of tissues. What's the difference between these two? We're coming to it. And then with developmental anatomy, which basically is going to be the anatomy, for example, embryology, where you have the baby developing inside mom's uterus. Okay. Whoa. Well, I pulled that up, guys, and then I lost my controls. Okay, let's see if we can do this. There we go. The flip side of that is the study of the actual functioning of the bodies. I know that says structures, but that's actually wrong. I'll correct that. It's what they do, and structure and function are really tied together. There's a reason why a hammer is shaped like it is and a screwdriver is shaped like it is. They're for different kinds of jobs. They fit different situations. So the way our body is actually put together is so that each part can do a certain job that keeps the entire body going. And we're going to talk about this in great detail in A&P. Gross anatomy, the larger, you can see there, that's, I don't know, that's a medical school, but they're actually dissecting a human cadaver. The people who donate their bodies to science, that's what happens. I had to do that during med school. It's something all the physicians do. And I think some of the chiropractors do that as well, but I'm not sure. Microscopic, over there you can see some of the cells. That's going to be chapter 3, I believe, that we're going to get into that. These are the things that you have to look at through a microscope. They're just too small to see otherwise. And and if you're in the lecture, then you're more than likely in the lab unless you're taking this for the second time. And we're going to, they kind of reinforce each other. Oh, there we go. Physiology, study of the structures what did I say? Gross anatomy. Ah, that shouldn't say physiology. That should say anatomy right there. I'm sorry. I will correct that though. That is the definition of anatomy. Physiology, the functions, we've already gone through that. Okay, I've had these PowerPoints key to learning objectives that the school has determined are what you need to go forward. And of course, our learning objectives are also based on the state standards, which the state tells us what you need to know before you get out of here. The first learning objective is going to be the anatomical position. Whether something is the front or the back of your arm depends on you're facing this way or this way. So in order to get around that and to make sure that we all start with a common point of reference, we have this gentleman up here. If you look at him, you'll see that he's standing up straight. His feet are slightly apart. The palms of the hands are facing forward. That's the anatomical position. So if we say the front or the anterior part of the forearm, then I know we're talking about this and not this. No matter which way the arms are facing, that's always going to be the anterior. It's just a convention, guys, to keep everybody on the same page. Okay, there's some directional terms. You need this not only for school, but you actually need this on the job. Your programs will require you to know this, because when you get to the hospitals or wherever, whatever healthcare that you guys are interested in, we have our own language. It's very specific, and it has to be, because we have to be accurate and precise. So we have our own language, and you've got to learn that language, and this is where you start. If you've had mid-terminology, you're going to be way ahead of the game, but a lot of folks don't, so we'll just go through it. Superior means toward the head. Now, this is when you're comparing two things. If I were to tell you that Jasper is south of, that wouldn't make any sense. South of what? It's north of some things and it's south of others. So when we use the term superior, we're going to be talking about things. Now this only applies, by the way, on the head, the neck, and the torso. The arms and the legs have an entirely different system of doing this. So I would say that my eyes are superior to my mouth because they're higher up on the body. They're closer to the top of the head. Your nose is superior to your umbilicus, your belly button. That's the kind of thing we're talking about. Inferior is just the opposite. I could say my nose is superior to my umbilicus. I could also say my umbilicus is inferior to my nose. It just depends on what you want to be talking about. If you're an ENT and you're doing all your stuff around the eyes, nose, and throat, then you're probably going to talk about the nose. And if you want to compare it to something, you'll, use superior. But it just depends. Excuse me. Don't let this throw you, guys. It's not as hard as it sounds. It's really kind of easy once you get to it. This is, I should have mentioned, I'm sorry, let me go back. Cranial or caudal. Cranial means toward the head, caudal means toward the bottom. Again, that doesn't include the arms and the legs, just the torso and the head. Mainly, cranial and caudal, I've seen it done in the OBGYN folks. That's the way they describe the baby before it's born. But most of the time, we're going to use superior and inferior. Now, here, for front and back, the front of the body is going to be the anterior. The back of the body is going to be the posterior. And again, use this to compare things. If I were to say blank is anterior to this, or the other thing is posterior. Now, ventral is also a word they use, and when we get into the nervous system, you'll see ventral and dorsal. For the most part, we use anterior and posterior. So I could say that the heart was anterior to the spine, because the heart sits in front of the spine is toward the back. So that's kind of an example of how we use that. Medial and lateral. Now this intermediate, I have never seen that used. Medial and lateral. So this is about, if we imagine that we've got a line running straight down us through here, you can see it on this little picture right there. We're saying something is closer to that or further away. So here's this. My ears are lateral to my eyes. What does that mean? It means they're further away from that imaginary line in the middle. And I can also say that my eyes are medial to my ears. It's the same thing. This is just describing whether something is further away or closer into the midline. How would I use this? How would I use any of this stuff? Well, you get a patient come in and he's got some sort of cut or an abrasion on his arm. You have to describe that, or on his torso, for example, since we were still in torsos. If he's got a scar right here around his belly button, you can't see mine. Let me bring it up. If I've got a scar right here, then I could say that this scar is, measure that, it's probably about 10 centimeters. I could say that scar is 10 centimeters medial to the shoulder. That's the kind of ways that we use this terminology. You need to know this. This is not something that you're just learning from school and then you can forget. This is something you need to know. Okay, guys, proximal and distal. And this is where we get to the arms and the legs. So, and folks confuse this, so make sure you understand superior and inferior torso and head. Proximal and distal arms and legs. Think of it this way, your arms and your legs come off of your torso. So we don't say that this is superior or inferior. What we say is something is either closer to the torso or further away. So again, if I were doing a scar and it was right here on the wrist, I would say that that scar is maybe 5 centimeters proximal to the wrist. And if you write that in a chart, everybody's going to know exactly where it's at. That's what this is for. So in testing and things like that, I usually put something like, I could say the ankle is distal to the knee. The ankle is further away from the torso than the knee. I could also say that the knee is proximal to the, well, I could say the knee is proximal to the ankle, but I could say the hip joint is proximal to the knee. How close is it to the main part of the body, the torso? And that's what we're looking for. Okay, superficial and deep. So the outer layer of us is our skin. It is the most superficial part of our body. Underneath your skin, you've got a layer of fat, you've got some muscles. So I could say that the muscles are deep to the skin. Underneath the muscles, we have bones. I could say the bones are deep to the muscles, or I could say the muscles are superficial to the bones. All this is talking about is how deep does it go inside your body. Something that's superficial is just going to be on the surface. Well, going to be closer to the surface, if not the actual surface. Okay, guys. Lateral, we talked about. Now, here's something. If a person comes in with his right arm and his left leg broken, that happens. I could say that those two breaks are contralateral. It just means you're on opposite sides of the body. If I want to say something is ipsilateral, I'm saying that they're on the same side of the body. My right ear and my right eye are ipsilateral. My two eyes are contralateral. They're on opposite sides. It's going to take a little, guys, you can't just hear this once and absorb it. You're going to have to practice this. You're going to have to study it. You got to know it. End discussion. This comes into play when we get to the skeleton, but in general, the head and the torso that we were talking about, we call that the axial. The appendicular, as in appendage, is the arms and the legs, or are the arms and the legs. I don't know which one of those is correct. We won't worry about it. I know this slide is way too busy for my comfort, but it is what it is, and we got to do it. So this is regional anatomy. Whether you're talking about the surface of the skin or something even deeper, this is where we call them. Cephalic means head. This part right here, your forehead, is called the frontal area. The area of the eyes, not the eyes themselves, but the area is called the orbital region. The nose is called nasal. I'm sure you guys knew that. The mouth is oral. I'm sure you knew that. Here's one that might throw you. Your chin is mental. That's what it is. The neck region is cervical. You can see that right there. Thoracic region is basically your chest area. It's subdivided, so the area around your armpits are called the axillary. The area around the pectoralis muscle, the pecs as they call them, is called the mammary area, obvious reasons. In the middle between the right and the left mammary regions, you have the sternal region. We'll talk about that. There's a bone. That's your breastbone right there. That's what it's all about. So underneath the rib cage, you have your belly, which is the abdominal region. The umbilicus, or the umbilical region, is just your belly button. The pelvic region is going to be underneath the abdominal region. It actually, there is a bone there that kind of defines that, so that's not a real problem. The area right underneath there and above the genitalia is going to be the inguinal region. It's actually that area where the legs fold. There's a crease right there, and I'm sure you guys know that. The inguinal region, or the groin. The pubic area is going to be the actual genitalia. Okay, so that's everything on that side. Let's go over here. Okay, the upper part of the arm, this part of your shoulder right here, just where from the top of the shoulder and the arm meet, is going to be the acromial region. This is going to make more sense when we get to the bones. The arm is the brachial. Now, the arm is only things from the elbow to the shoulder. This is a forearm. This is not the arm. So there's the brachial region. This area right here, where your elbow folds, is going to be the antecubital region. The forearm is antebrachial, which means before the brachial. Your wrist is the carpal region. I'm sure everyone's heard of carpal tunnel syndrome. It involves the wrist. The hand is called the manus, and think of manual, or labor. The palm is the palmar. That's pretty easy. Now your thumb has got a name, special name. It's called the pollex, P-O-L-L-E-X. And when we get to the foot, we'll talk about it. There's one that sounds very close to that, and people get those mixed up. Your fingers, aside from the thumb, and your toes are all called digital. Everybody knows these are digits. Okay, coming down, the hip region is oftentimes called the coxal. The thigh is called the femoral region. That's where your femur is. The kneecap area is called the patellar region. The kneecap itself is the patella. The leg is crural, C-R-U-R-A-L. Now, when you get, by the way, this is the thigh right there, and the leg is actually what's underneath the knee. Again, very specific. This area on the outside of the leg down here is going to be called the fibular, is what we normally, you'll see peroneal every once in a while, but fibular for the most part. The foot is pedal. Everybody knows you got pedals on bicycles for your feet to push. The ankle region is called the tarsal. Now, when you get past the ankle bones, you've got some other bones. These aren't your toe bones. These are the bones in the feet. But that region is going to be called the metatarsal. And again, the toes are called digital. Now, here's that other one. Pollex is the thumb. Hallux is the big toe. It sounds a lot, and I'm just giving you a heads up. Folks miss this on tests, so I would spend extra time on that. Okay, going back, there's the acromial again and the brachial. Now, behind the elbow, in front is antecubital, behind is olecranon, antebrachial, manus. Now, we didn't go into the hand bones. The bones that are in the palm of your hands, we know the wrist are the carpal, and beyond those are the metacarpals. Those are in your palm, and in your digits, your digital region is where the finger bones connect to the metacarpals. We already did femoral. This is something everybody always tells me there's no name for the area behind your knee. Actually, there is. It's the popliteal. Now, crural is the leg, which is everything below the knee. Sural, again, it sounds alike. You got to keep them apart. Is just the calf. There's the fibular. Here's the parts of the foot we did not do. Your heel is the calcaneal region. The bottom, or the sole of the foot, is the plantar region. Okay, I know there's a lot of sound alike, but guys, when you get to the hospital, you're going to probably have two patients named Smith or Jones. You got to give the right one, medication or treatment. So you're going to have to be able to keep things straight in your head. Cephalic we already talked about. Now, we didn't talk about this. The ear is called the otic region. So mom brings in the baby for an ear infection. We give them otic antibiotics. This region right here, it's actually right here just underneath where the skull bulges out, is called the occipital region. Cervical we talked about. Now on the back, or the dorsal region, or the posterior, up there around the shoulder blades is called the scapular region. So we have a scapular on the left and on the right. Going down through there is the vertebral region, because your vertebrae, your backbone, is back there. When you get to the small of your back, right up above the buttocks, you're going to be in the lumbar region. Underneath that, in like a little triangular shape, is going to be the sacral region. The buttocks themselves are called the gluteal region. Now, the perineal region is going to be between the buttocks and the genitalia. It's that very small region that's on the very bottom of the torso. That's also the region where they don't do it as much anymore. I can only remember doing one episiotomy, but a lot of times when mom delivers a baby, and if the opening isn't large enough, they would go in and cut it to facilitate getting the baby born. Nowadays, they have decided it's better to just let it tear and then suture it. So, of all the deliveries I've made, I only did one that had an episiotomy. Okay, I think we've got through that. Body planes and body cavities. So I talked about that imaginary line running straight up and down. Now, if you imagine this line, and if you imagine this line, it divides you into an equal right and left half. That's going to be the mid-sagittal plane. Now, there are a lot of sagittal planes, but there's only one mid-sagittal plane. But that's really going to be a topic that we can, a topic that we can discuss more in the lab. So we have the sagittal plane that divides us into a left and right half. We have the coronal plane, and that divides us into a posterior and interior, front and back. And then we have this transverse plane, which divides us into a superior and inferior, top and bottom. Okay, body cavities. Guys, there's a lot of body cavities. And a lot of people will get confused on this. So let's go with the simplest ones first. The dorsal cavity, dorsal means back. That is the dorsal cavity. Now, the part of the dorsal cavity that has the brain only is called the cranial cavity. The part that only has the vertebrae or the spinal cord is the vertebral cavity. That's it. So how would this be questioned on a test? Well, I might ask you, what is the name of the cavity that contains the brain and the spinal cord? Then you would say dorsal. But if I ask you, what is the name of the cavity that only contains the spinal cord, then dorsal will not be right, because the dorsal cavity contains more than that. There, I want you to tell me vertebral cavity. That's going to be one of the things. Sometimes the questions will tell you how specific we want you to be, what's included. Okay, that was a simple one, guys. Now we're going to talk about the ventral cavity. There's a lot in here. We've got the thoracic part, and on this thoracic part, we're going to have 4 cavities that it's divided into. You got a right lung and you got a left lung, so you have 2 pleural cavities. You have 1 heart that's in between the 2 lungs, so you have 1 pericardial cavity. Up above the heart, you have all those humongous blood vessels that come in and out, and that's a superior mediastinum. That's, again, if I ask you what is the name of the cavity that contains the heart and lungs, then you can say thoracic. I didn't say mediastinum, but it doesn't matter. If it contains the heart and the lungs, it's the thoracic. But if I ask you what contains only the left lung, the left pleural cavity, that's the way it goes. Okay. Here's the abdominal cavity, and right there is that bone. That's everything below that bone in here is considered to be the pelvic cavity. This is the abdominal cavity. In general, especially in the lecture or in the lab, I just prefer you to call it the abdominal pelvic. There's really no barriers. I mean, these cavities are physically cut off from each other. They're separated. There is no separation between the abdomen and the pelvic cavity. It's one big hole that just happens to go down. So a lot of times we'll just call that the abdominopelvic cavities. Okay, hopefully I didn't lose you on that. If I did, pause this video, go back, look at it, study it. Cannot get out of A&P1 without doing a lot of work, at least not in a passing mode. Oh, I got to move my thing. Well, I'll move it when we get down here. The thoracic cavity is the two pleurals with the lungs, the mediastinum, pericardial, the abdominal pelvic cavity. Oh, I'm getting smaller. It's got the stomach, the intestines, the spleen, and the liver, a lot of other things too. The pelvic cavity is going to have the bladder, the reproductive organs, and the rectum. Okay. Now that would be big enough. Hopefully you guys can see me okay. If you want to. You don't need to see me. And you know what? I think I ought to just move over here. Okay, the other body cavities. Now these we haven't talked about, but these things are going to make sense to you. Inside your mouth is a big empty space. Yeah, you got teeth and you got gums, but basically it's empty space. It's the oral cavity. There are digestive cavities. That's the inside of your GI tract, the esophagus, the stomach, the bowels. The nasal cavity, I'm sure you've probably heard about that. That's the inside of your nose is hollow. The orbital cavities are the holes in your head that the eyes sit in. There's cavities behind the eardrum, and then we've got cavities around some of our joints called synovial cavities. We'll get to that, guys, when we at the appropriate time. Okay. Serous membranes. This is kind of hard to visualize, so let's take our time a little bit. Around the heart and around the pericardial cavity, there is a membrane. In other words, it's a sheet of tissue that kind of separates them. The part of that tissue that's on the heart is called the visceral pericardium. The part that lines the pericardial cavity is called the parietal pericardium. Now that's actually, I don't know if you guys can see that, but if you look, you see that one blue line, it goes up. It's kind of like shrink wrap to the heart, and then it does a 180-degree turn and then lines the cavity. So it's actually like if you had a balloon and you stuck your fist into it, you would have two areas because there would be some area of separation between the part of the balloon that's attached to your hand and the part that surrounds it. And that's about the closest that to me, that's the easiest way to understand that. It's just one membrane, but it just kind of surrounds both the organ and the cavity. So for the lungs, we have the same thing. These are called pleural cavities. So this is going to be the one on the lungs itself is visceral pleura. You just kind of drop the L. The one that aligns the pleural cavity is the parietal pleura. By the way, that's a place where people get pleurisy. Very painful. Tell you more about that in the lab. Okay. When we talk about the abdomen's got a lot of organs in it. It's a relatively large area on the body, so we kind of split it up. So what we do, if you look at these two blue lines, that place where they cross right there is your belly button, the umbilicus. So on the right side of your body, we have a right upper quadrant, and we usually just abbreviate that RUQ. We have a right lower quadrant, RLQ, left upper, LUQ, and left lower, LLQ. That's what we mainly use in the hospital. However, for school, they can also divide that abdomen into 9 areas. I've never seen this used clinically, but it's part of the school thing. So the area, the center, it's kind of like a tic-tac-toe box. The center area is going to be the umbilical region. the area on the right and the left of that's on the same level is going to be the right and left lumbar. You remember I told you about the small of the back. Now, right there, it's right up above the stomach. The stomach is right there, is the epigastric region. Now, the rib cage comes down like this, and underneath the rib cage is the hypochondriac regions. You have a right and a left hypochondriac. Down here is the hypogastric, which means kind of way under. And you got a right and a left iliac region, and that's because there's an iliac bone there. That's it. I mean, it's in the, we got to teach it. I'm not real fond of it. I never used it, but it's there.